Hi, I'm Dr. Roger Tsai, and I'm a board-certified plastic surgeon in Beverly Hills, California. Today, I want to talk to you guys about breast implants. There's so many different types and shapes and sizes, so I wanted to go through that with you today to clear up any confusion and provide some knowledge. So, first thing I'd like to start off with is let's talk about the difference between silicone and saline, okay? So here's a saline implant. Saline is basically sterilized water. It's basically the same material that they give you in an IV when you go to the emergency room or if you're dehydrated. So the shell itself is still silicone, but the inside is filled with saline water, okay? When it comes to a silicone implant, the outside shell is still silicone, but the inside is filled with silicone as well, okay? I like to think about it like an M&M. Sometimes one's filled with chocolate, sometimes one's filled with peanuts, and just different fillings, but the outside is still exactly the same. So for those patients who don't want to be exposed to silicone, that's a myth. The outside of a saline implant is also silicone, so your body sees silicone regardless. It just depends on what's on the inside, okay? So with a saline implant or a water-filled implant, it tends to be a little bit more firm. The disadvantage is it tends to ripple more. You can see this ripples a lot more than the silicone implant. So again, the disadvantages of saline implants is they ripple more, they tend to be fuller and tighter, and they give you more of the faker, more exotic look. The advantage though is that if it were to burst or pop, it's just like a balloon. All the water will come out, your body absorbs it, and you'll see an immediate change in the size. Here's a silicone implant, okay? The advantage of a silicone implant that it's nice and soft, it ripples a lot less, and it's made to mimic breast tissue. Okay, the newest generation of silicone implants are called gummy bear implants. And what that entails is if you were to cut this even all the way in half, if you've seen some of my videos in the past, you can see that it doesn't leak anymore. It's a semi-solid, okay? So the disadvantage of silicone implants kind of have been removed. Again, the advantages are it's a lot more softer, it's a lot more natural, and therefore the silicone implant is significantly more popular than the saline implant. But the saline implant is still a very good implant. So I wanted to show you guys and talk to you guys about the differences between these two here, okay? So when it comes to the saline implant, there's really not much to say. They have it's kind of one on its own. There's not many options when it comes to saline implants, okay? When it comes to silicone implants, we have a lot of different implants to talk about. The next thing I like to kind of describe is the difference between a smooth shelled implant and a textured shell implant, okay? The smooth shell implant you can see is very slick. If you put water on, it really just rotates and moves around, whereas this textured implant is made for that your body can scar into it. It doesn't move. It kind of stays where you put them. So the disadvantages and advantages of both. One thing to realize and talk about is one of the implant companies, Allergan, has actually voluntarily removed their textured implants because they have been shown to be associated with something called ALCL, or anaplastic large cell lymphoma. It's a type of blood cancer, okay? So any of these types of textured implants have been much less popular because of its association with potential cancer and issues like that, okay? So to go over the texturizing, again, these are more older technology, but to give you some knowledge, and for those patients out there who are still maybe potentially interested in these implants, because there are two other implant manufacturers that do sell these. You have your anatomical or your tear shop shaped and your round implant, okay? So this round implant is a circle. You can turn it, you can move it, it's a little circle. When it comes to the anatomical implant here, it's thin on top and it's thicker on bottom. This is also called a teardrop implant for those of you who like the more generic term, okay? Again, the reasoning for the texturization is so that the implant stays exactly where it's placed. You don't want this moving around, right? You don't want the thin part to be on the bottom or to the side and the thick part to be on the top. So again, the reason it's texturized is because it sticks and your body scars into that, okay? So that's what the texturizing does. However, like I said a minute ago, the texturized implants have been falling out of favor recently. And again, in order to have this teardrop shaped implants, you have to have texturizing. So with that being said, you can't really get a teardropped smooth implant. Teardropped implants are always texturized because again, it scars in like that, okay? Again, both of these types of implants are falling out of favor. So now we're left with, again, the smooth, round silicone implants been around forever. The last thing I want to talk about is the different sizes, okay? It ranges from something as tiny as this, 125 cc's, to 800 cc's. You can see the significant difference. 200 cc's is approximately 1 cup size, okay? So this 800 cc implant is 4 cup sizes. This 125 is hardly half of a cup. Okay, so it ranges anywhere from this small size to this big size. So that's basically the 101 when it comes to breast implants. Obviously, talk to your plastic surgeon in more detail and depth about which one is best for you, depending on your goals and your aspirations. But hopefully, this was a little bit educational and gives you guys a little bit more insight to the different types of implants that are available these days. Again, my name is Dr. Roger Tsai, and I'm a board-certified plastic surgeon in Beverly Hills, and we hope to see you soon.